What's up, you guys? Welcome back to my channel. If you're new here, my name is Margaret. I am a second degree nursing student. I'm about halfway through my accelerated nursing program, and today I wanted to talk to you about my 5 tips for getting the most out of your clinical experience. When I was getting ready to go to nursing school, the thing I was the most excited about was my time in clinical. I had never really had any experience in a hospital because I came from a background that had nothing to do with healthcare. I knew that that was going to be my time to take everything in. I wanted to work with patients. I couldn't wait to start learning different skills. I think that a lot of nursing students would agree that that is the time when you learn the most and you improve the most as a nurse. You can only learn so much in the classroom and in the skills lab, and that time is so important. But when it all comes together and when it really clicks for me is when I'm in the hospital and I'm doing it with my own 2 hands, when I'm talking with the patient, when I'm practicing a skill, when I'm physically seeing the things that are happening. That's when I feel like I'm learning the most. And anyone knows who's already in nursing school or maybe is about to start that things have looked a little bit different during the pandemic. So my clinical time personally has been cut in half, and the other time is spent in the skills lab or online. And while those things can teach you a little bit, like I mentioned, it's not the same as being in the hospital. So because of this limited time, I want to soak up as much as possible during my clinical experience. So over the past couple months, I've really been thinking about how to maximize my time in the hospital and what I really want to get out of it. What am I looking to learn, or how do I want to grow during my time in clinical? And today I wanted to kind of share things that I've learned and how I am making sure I'm really using that time wisely. My first tip is to ask questions. There are actually no stupid questions. And I know that that's easier said than done. It might seem really simple to say, ask questions, tell people when you don't know something. This might be a personal thing, but I found that it can be a little intimidating in a clinical setting with your peers and your nursing instructor to sometimes admit that you don't know something. And I've found myself, sitting around the table at post-conference, and my nursing instructor says something about a disease process of a patient we saw. And she goes, "Do you understand that?" And everyone's kind of quiet. And in my head, I'm like, I don't know what that means. And everyone else is quiet, so I'm like, they must know something I don't know. And maybe we learned it in class, so I shouldn't admit that I don't know it. That's a long way of saying, I get being intimidated saying that you don't know something or asking a question because you feel like you should know it. But in nursing, there are really no stupid questions. And the difference between knowing and not knowing in nursing is a big deal because that is influencing your patient care. And you cannot fake it till you make it on a lot of skills in nursing. In your clinical time, something that you should remember is that is your time and it is your valuable time to learn. You shouldn't be afraid to ask questions. You're not gonna look stupid, and it's better to ask right then in that moment and rely on the teachers that are there to help you than maybe get really far down the road and you're still not quite sure about that thing and you're gonna have to ask eventually, or it's gonna result in maybe a mistake that could have been avoided. But when you go into a clinical setting, I try to remind myself why I'm there, and nobody expects you to be the best nurse or to know everything. And even if you learned it in class, even if you learned it yesterday, if you don't remember something or you weren't quite clear on it, there is nothing wrong in asking your instructor, asking the nurse that you're shadowing. 9 times out of 10, they are going to be super understanding, show you how to do it, walk you through it. And if they're not, then that's their problem and not yours. And my second tip is take every opportunity for experience. This is something I learned on my very first day in clinical. I got very lucky and had a nurse that was super engaged with me. The way that that clinical worked for me is my instructor would assign us to a nurse and one of her patients or one of their patients, and we would just shadow them and take on some responsibilities for one of their patients. My nurse was phenomenal. She really embraced having a student with her and let me do everything. And this was my first day in the hospital. By the way, I just want to clarify really quickly. I mean everything like within my limits. I think I've mentioned this before, but I do not mean like just take it on your own and start like doing things that you're not supposed to do. What I mean is, you know, she was offering me to do things that maybe I hadn't even really learned yet. Like she asked me if I wanted to flush a line, and it's a very basic skill at this point, but then I was like, sure, I don't know. And she was just so enthusiastic that I felt very comfortable doing those things. And I left that day just feeling elated, and I felt like no minute was wasted. I was learning every second of that shift. And you're not always gonna get the nurse that's gonna, you know, take you under her wing and let you do a bunch of stuff and be very excited about having a student. That's okay, because you don't need that. What you need is to be enthusiastic and ready to learn and jumping on those opportunities. If you're in the hospital and you see a chance to go do something, do it. Do that skill, even if you've done it 100 times before. If someone says, hey, do you want to come do this? Go with them and do it and see it and observe and learn and listen. And I think that that will just maximize your time. I've kind of forgotten that mentality the more I'm in clinical. I'm on a floor right now that is very difficult for me. I am not very enthusiastic about it. And you're not going to be in love with every floor that you're on. We were in post-conference, a nurse came in and said, hey, I'm doing this. Does anyone want to come help? And I let, you know, someone else kind of be volunteered to do it. And then as soon as she left the room, I was like, I really should have jumped on that opportunity. I wish I could have seen it. It was something I hadn't seen before. And I was kind of asking myself like why I didn't take that chance. I think that I'd gotten in this mentality of I like this, I don't like this, this is where my career is gonna go, this is not where my career is gonna go. And I had to kind of reset with myself and remind myself that I am so new into my nursing journey that I don't really get to decide right now what it is I want to do and what experiences I want to have and block out everything else. It's gonna ebb and flow, but if you get a chance to kind of set expectations with yourself each time you go into the hospital, I would just say remind yourself to just seize those chances. And if your nurse keeps walking away from you, freaking follow her and go into that room and offer to help. Not everyone's gonna extend a hand to you and offer these things, but you can grab it. You can take those opportunities. You can make your own opportunities. You can find another nurse and say, hey, I'm here for the day. If you need anything or you're doing anything cool, and they'll know what that means, just snag me and I'd love to watch. And most of the nurses that you meet, I think, are gonna be willing to have you tag along. Only you are gonna determine whether it's a good day or a bad day or a crappy floor or a great floor. You know, it's not always gonna be the really cool, intense stuff. Sometimes it's gonna be very simple or just time to chat with a patient, but every single one of those experiences is gonna make you a better nurse. All right, number 3 kind of tags along with number 2, but that is don't let fear keep you from trying a new skill. So you are gonna have to keep progressing, but don't let being scared of something keep you from doing something new. One, because you're probably gonna have to do that thing eventually, so it's so much better just to rip the band-aid. And honestly, I can say that most things are gonna be way less scary than you think. And also, you're in nursing school, so take advantage of having instructors around and people who care about your education to try new things. So for example, one of the things I was very nervous about was doing a Foley. I got the chance to do it on a patient, and I was very nervous, almost to the point where I asked the nurse to just take that one and I'll watch her do it. But instead, she was very nice, very encouraging. My instructor pushed me in the right way, and I'm super glad that I did. And you know what? Probably next time, I'm still gonna need someone to be there with me and maybe walk me through it again. And that's fine, but I feel much better having done it once before. You're gonna have to give those injections, you're gonna have to do a Foley, you're gonna have to do all sorts of things that might make you uncomfortable, whatever that may be. Or you might be freaking fearless, except for you don't want to see a wound kind of thing. And you're gonna have to do those things, but I promise you, as soon as you do it, I think that this weight will lift and things will get easier and you'll become more confident. And I think that's something that you can take all the way through into your career. I obviously have never been a registered nurse before, but this is a career of continuing education and continuing learning. You're never gonna stop being a student. Doing those things that scare you and pushing your limits helps you grow. Okay, I think we're on number 4. So this is to seek out feedback. Part of the reason you're in the hospital, part of the reason you have these clinicals is to be observed by a clinical instructor and receive feedback to grow in your skills and to grow as a nurse. I think feedback is really, Olive came to join. I think feedback is really valuable. I think it's the way that you're gonna grow. And I think sometimes you need to look for that feedback if it's not being given to you. During most clinical rotations, I'm guessing they're gonna have time for evaluations, but you don't always have to wait until you sit down with your instructor to receive feedback. Many instructors will just give it along the way, but if you feel like you're not getting kind of any indication of how you're doing from your instructor or the nurse that you're paired with, definitely feel free to ask them how you're doing. And I wouldn't ask them every day, all day, after every single skill, but let's say you go in and like you do your head to toe for the first time and you leave the room and the instructor's gonna move on, but you're kind of unsure of how things went. You should feel free to be like, hey, I thought that went okay, but do you have any tips? Did I miss anything? Is there anything you would have done differently? That's a good time for them to quickly review with you in real time what you did. I would definitely say being in the hospital is a fast-paced environment and you're not gonna have time for that all the time. And especially if you're paired with a nurse and it's not an instructor that's dedicated to be there with you, then they might not have time to answer because they have a full set of patients and a student. But definitely look for that feedback, whether it's during the day, when you're in the hospital, during your evaluations, and take that constructive criticism or advice or tips and use it to grow rather than taking it as criticism. I think it's hard to be told that you're not good at something or that you need to be improving on something, but in this profession, I feel like it's super important while you're in school to get as much of that feedback as possible so you can grow and learn and take those notes to your future career. And my 5th and final tip is to take time to reflect. Especially if this is your first hospital experience, clinical can be intense. You are learning a lot. It's a long day on your feet. You're seeing all sorts of things that you've probably never experienced before. And you're probably receiving feedback along the way. That's a lot to take in. And I think it's important to come home from those clinicals, take time for yourself and reflect on what went right, what went wrong, what you want to get out of your clinical experience, things that you might want to try next time. So what's something you didn't get to do during this clinical day and you want to do it during your next clinical day? I'm not just talking about skills and the technical stuff. I'm also talking about kind of the emotional patient things as well. Being in the hospital can be really hard sometimes and it can be very draining emotionally. I think taking some time to decompress, whether it's in the car on the way home or just kind of an evening to really marinate in what you experienced that day, can help in just so many ways. I don't know, for your mental health, for the sake of your experience and what you're looking to get out of it and what you're looking for post-graduation. I just don't, it's like stretching after a workout. Don't forget to file those things away in your mind and really think about what you went through that day and where you're going from here. All right, that's all I've got for today. Thank you so much for watching. If you like this video, please give it a thumbs up and don't forget to subscribe because I put up new videos every single Monday. I'll see you next week.